Repair hair transplant. How is it planned? We are going to discuss repair hair transplant and its planning by showcasing one of such patients in whom we did a repair hair transplant few months back. And also in this video, we are going to discuss a very important application by which you can preview your own hair transplant results before actually undergoing a hair transplant. So we request you not to miss out on any of these important parts of this video. A 49-year-old male approached us with a problem of getting a hair transplant done thrice with very suboptimal results. He had undergone one FUT procedure way back in 2011. Second FUT was performed in 2015. FUE hair transplant was done on him in 2018. So in total, between 7,000 to 7,500 follicular units had been transplanted in this patient. He was having a medical problem of blood pressure and was taking medicines to control that. There were few specific problems which he wanted to be addressed. The first one was that his hairline was low, unnatural. It was very straight. Second thing was the temple points. The angle of these hairs was very weird. They were coming out almost 70 to 90 degrees and it was very, very unnatural. Third thing was the suboptimal density, especially in the mid-scalp region and also to some extent in the front also. So these were the problems with which he presented. We did his trichoscopy, and in his trichoscopy we found out that the majority of his scalp hairs which were remaining were almost intermediate or vellus hairs, which means they were very, very thin hairs. Hardly 30 to 40% of his donor hairs were terminal. So we discussed this with him. His density of follicular units at the donor site was again very low. It was around 65 to 66 follicular units per centimeter square at the donor site, which is very poor. Also, his coverage value in the donor site was very low. It was around 5.66, which is very low. Majority of his hairs were 1 and 2 hairs, and his average hairs per follicular unit, which should be around 2, was around less than 1.7 in his case. So we also did a trichoscopy for the beard to see if the other body hairs were suitable for him, and we found out that the density and thickness of the beard hair was quite good in his case. It was a good source for us, but the problem is we cannot take out more than 20% of the beard hair along the scalp hair. If we try to use many higher percentage of beard hairs, many beard hairs will give a very unnatural wiry appearance at times. Sometimes they are called as bird's nest. So there is a limit to what we can use from beard in a single sitting. We told him that ideally he should undergo a biopsy and then plan a hair transplant, maybe in a separate sitting or somewhat. He understood all the limitations of the procedure. Also, he requested to correct his hairline. Please like the video if you like the planning and the approach which we take in planning each and every hair transplant. We also found out that his donor site there were around 8,000 follicular units still remaining. So we said that we will try to take out around 3,000 to 3,500 grafts on the scalp and around 5 to 600 grafts on the beard for his case, and at the same time we'll do a biopsy also for him just in case things can improve by medical treatment along with the transplant. So he agreed to our plan. After this, we did his recipient area calculation and we found out that it was around 135 square centimeter. We planned a density of around 30 to 35 follicular units per centimeter square, and we found out that he approximately needed 4,000 follicular units in his case from scalp and beard to address his area. If you are planning a hair transplant for yourself, please write down either in the comment section below, call us at the number mentioned here, do WhatsApp us your pictures and your details on the numbers mentioned here so that we can try to help you out with this problem. So when we started the procedure in this case, the first thing we planned was how to improve upon the hairline. So we decided to make the hairline a bit higher up and to make it more irregular, and this needed the extraction of the follicular units from the lower and straight kind of hairline. So after giving the local anesthesia and doing the slits and everything, sides making, and then we started with the extraction of the grafts. So we took out the grafts which are lower and were making the hairline low. Apart from this, we also extracted the grafts from the temple point on both sides. After doing this, we took out around 32 or 300 grafts from the scalp itself. We took out around 600 grafts from the beard, and the remaining grafts we used were from the extracted grafts. So we did around 4,015 grafts in this case. The number of 1, 2, 3, 4 hair follicular units you can see on the screen itself. This was the distribution. Also, we took out a 3mm biopsy from one of the area which was having poor growth, and then we sent it to a dermatohistopathologist, and fortunately Unfortunately, there was no other factors, and after this extraction was performed, our team inserted the grafts into the sites which were already created. So this finished the entire procedure. Please subscribe our channel if you want to know more about such interesting cases. Now I want to discuss something about Saraswat Hospital App. This is an app which gives you a realistic scenario of the kind of results you can expect after your hair transplant. So all you have to do is to go to the iOS store or a Play Store and download this app, fill up your data in very easy steps. After a customized input from our ABHRS doctors, you will get your results showing you the kind of results you can expect after your hair transplant, along with the number of grafts required in your case, detailed questionnaire which you should be asking your hair transplant doctor at the time of consultation. So to summarize this video, number one point is never to go for a very low or a straight hairline as is being seen. Second thing is every hair transplant has to be planned with the tool of our latest gadgets like trichoscopy. Third thing is about temple point. Temple point are known to be notorious. Do not go with the fact that every case of hair transplant needs a temple point. Another important thing is that beard is a good donor site apart from the scalp, so it can be used. Last but not the least, the perfect doctor who is performing your hair transplant should be a well qualified, credentialed doctor. So this is the point I would like you to take away from this video, which is very interesting. If you want to know what kind of hair transplant results you would have, you can watch the video on the left hand side to know more in detail about it. And if you want to know or see one of our latest hair transplant video of a patient showing its results, you can click the video on the right.